If you've ever looked down and thought, wait, is that normal? You are not alone. Most women have never been taught what their period blood is actually telling them. And some of what you're about to hear could genuinely save your life. Welcome back to Women's Sexual Health, the space where we talk about everything your doctor doesn't always have time to explain, and everything nobody taught you growing up but absolutely should have. I'm Dr. Rebecca Ross Blake, a certified women's sex therapist with over a decade of clinical experience working with women just like you. In my practice, I have sat with hundreds of women who felt confused, embarrassed, or even frightened by changes in their bodies. And one of the most common things I hear, I didn't know that was something I could even ask about. Well, today we're asking, we're answering, and we are leaving nothing on the table. Before we dive in, if you are new here, please hit that subscribe button right now. Every week we publish honest, research-backed, clinically grounded conversations about women's health, sexuality, and well-being. This is your space, and you deserve to have it in your corner. Subscribe, and let's keep going. Why your period blood color matters. Let's start with something important. Your period blood is not just waste your body is discarding. It is information. It is a monthly biological report generated by your uterus, shaped by your hormones, and colored by everything from how fast your blood is flowing to what is happening inside your reproductive system at that exact moment in time. For generations, women were taught to manage their periods quietly and ask as few questions as possible. We were handed products, told what was normal, and sent on our way. But here's the truth, what most of us were told was normal is actually just what is common. And common and healthy are not always the same thing. The color of your menstrual blood is one of the most accessible, visible, and genuinely useful health signals your body produces every single month. And once you know how to read it, you step into a completely different relationship with your own body. The color guide, what each shade means, bright red, bright vivid red. Period, blood is generally a sign that everything is moving the way it should. This color indicates fresh blood flowing at a healthy pace from a well-developed uterine lining. You'll typically see this at the height of your flow, usually days 2 and 3 of your cycle. In clinical terms, bright red blood means the uterus is contracting efficiently, shedding the lining quickly, and the blood has not had time to oxidize or sit in the uterine cavity. For most women, this is the color you expect to see when your period is at its heaviest. One important note, if your flow is extremely heavy alongside that bright red color, meaning you are soaking through a pad or tampon every hour for several consecutive hours, that warrants a conversation with your healthcare provider. It could point to fibroids, polyps, or a hormonal imbalance that deserves attention. Dark red or maroon blood is also completely normal and is simply blood that has moved more slowly through the uterus before being expelled. You will often see this color first thing in the morning, after you've been lying down for several hours, or at the very beginning and end of your period. Think of it this way, the slower the flow, the darker the color. This is basic oxidation. It does not mean something is wrong, it means your body is doing exactly what it is supposed to do. Brown or black. If dark red blood is slow moving, brown or black blood is even slower or older. Brown and black period blood has had the most time to oxidize before leaving the body, which is why it takes on that darker appearance. This is extremely common at the tail end of a period and sometimes at the very start, particularly if your body is finishing up residual blood from the previous cycle. It can look alarming if you've never been told about it, but in most cases it is nothing to worry about. However, and this is important, if you are experiencing brown spotting regularly between periods or brown discharge outside of your normal cycle window, that is worth investigating. It can sometimes be a sign of an underlying hormonal imbalance, a thyroid issue, or in women approaching or past menopause, something that needs medical evaluation. Pink or light pink period blood is typically the result of menstrual blood mixing with cervical fluid, which dilutes the color. You might see this at the very beginning of your period or during light spotting mid-cycle. However, if your entire period appears consistently pale pink and lighter than usual, it may be worth paying attention to. Chronically light. Pink-tinted periods can be associated with lower estrogen levels, which is something that becomes increasingly relevant for women in perimenopause or those who are physically very active, under significant stress, or dealing with nutritional deficiencies. Low estrogen does not just affect your cycle. It affects bone density, cardiovascular health, mood, and libido. So if pink is your new normal, bring it up with your doctor. Orange period blood sits in a category that requires a little more attention. Sometimes, orange coloring is simply the result of red blood mixing with yellow cervical fluid, which can give it that orange-tinted appearance, particularly at the beginning or end of your cycle. But orange discharge or period blood can also be a signal of infection, specifically bacterial vaginosis or a sexually transmitted infection. The distinguishing factors are usually smell and consistency. If the orange color is accompanied by an unusual or unpleasant odor or a change in texture, please do not wait to see a healthcare provider. This is your body flagging something that is easily treated when caught early. Gray is the one color on this list that should always prompt you to seek medical advice. Full stop. Gray vaginal discharge or period-like bleeding can indicate bacterial vaginosis, a common but important infection caused by an imbalance in vaginal bacteria. It can also, in the context of early pregnancy, indicate a miscarriage. If you see gray, especially if it is accompanied by tissue-like material, an unusual smell, or pelvic discomfort, please contact your healthcare provider as soon as possible. This is not a color to wait out or Google your way through. Get seen. Watery or pale watery, very pale, or almost translucent period blood is another variation worth noting. This can sometimes point to anemia, particularly iron deficiency anemia, which is more common in women than most people realize. It can also be associated with a generally thin uterine lining, which may have implications for hormonal health and fertility in younger women. If your flow has become noticeably lighter, more watery, or paler in color over time, and is accompanied by fatigue, dizziness, or feeling cold frequently, bring it up at your next appointment. Clots and texture, what's normal, what's not. While we're on the subject of what your period is telling you, let's talk briefly about clots, because this is another area where a lot of women feel uncertain. Small clots, roughly the size of a grape or smaller, are considered normal, particularly on heavier flow days. They form when blood pools temporarily in the uterus before being expelled, and the body's natural clotting process kicks in. What is not considered normal is passing clots larger than a small coin consistently, repeatedly, and in large quantities. Large, frequent clots can be a sign of uterine fibroids, endometrial polyps, adenomyosis, or a significant hormonal imbalance. These are conditions that are very treatable, but they do need to be diagnosed. If you are passing large clots regularly, please bring it up with your doctor. You are not being dramatic, you are being an advocate for your own health. And that is exactly what you should be doing. A special note for women over 60 now. A section that is especially important for those of you who are in your 60s and beyond, or who are navigating perimenopause or postmenopause. As estrogen levels decline through the menopause transition, periods naturally become lighter, more irregular, and may shift in color, often moving toward lighter pinks, browns, or very sparse spotting before stopping altogether. These changes are expected and are a natural part of the transition. But here is what every woman over 60 must know, clearly and without hesitation. Any bleeding after menopause, any spotting, any discharge that resembles a period, must be evaluated by a doctor. Postmenopausal bleeding is never normal. It can be caused by vaginal atrophy, which is common and very treatable. But it can also be an early symptom of endometrial cancer or cervical cancer, both of which have excellent outcomes when caught early. Do not dismiss it. Do not wait to see if it happens again. Do not assume it is just hormones. Please make the appointment. Early detection saves lives, and you are absolutely worth that phone call. Here's what I want you to leave this video knowing. Your body has been communicating with you every single month for most of your life, and your period blood, every color, every shift, every change is part of that conversation. Bright red, dark maroon, brown, pink, orange, gray. None of these colors exist in isolation. They each carry context. They each carry meaning. You are not meant to feel confused or embarrassed by what you see. You are meant to be informed. You are meant to be equipped. And you are meant to walk into every healthcare appointment knowing what questions to ask. Knowledge is not anxiety. Knowledge is power, and you have every right to it. If this video gave you something useful, a new understanding, a question worth asking, or simply the reassurance that your curiosity about your own body is valid, please give it a like and share it with a woman in your life who needs to hear this. Leave a comment below and tell me, was there a color on this list that surprised you? I read every single comment, and your questions often become our next video topic. And if you haven't subscribed yet, now is the time. Hit that button, turn on notifications, and join thousands of women who are choosing to understand their bodies rather than just manage them. I'm Dr. Rebecca Ross. Thanks for watching.